Welcome to SDHC's Health and Wellbeing podcast. Before we begin, we want to emphasise that the information shared in this podcast is for educational and informational purposes only. While we strive to provide accurate and up-to-date content, it is not a substitute for professional medical advice, diagnosis or treatment. Always seek the guidance of your doctor or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Remember, your health and well-being are invaluable, so prioritise consulting with a medical professional for your personalised care. Hi everybody, you're listening to the Health and Wellbeing podcast from Hillbrow Health and Wellbeing and SDHC with your host, Dr. Nick Harvey. The purpose of this show is to help people understand how they can help themselves and others with their health and well-being. Every episode, I interview an everyday expert to understand the latest evidence and advice on how to improve your own health or help others. Joining us today is Hansa Raja, founder of Holding Space, a registered charity based in Eastbourne. Holding Space offers parents and carers peer support, providing safe, non-judgmental space where individuals can connect with others on a similar journey. The organisation supports families whose children are struggling with their mental health. Hansa has 20 years of experience in cancer and cancer nursing, both at clinical level and strategic level. She also has experience in the charity sector, having held the position of operations manager at Eastbourne Food Bank. Having spent all of her career in the NHS, Hansa has always had a passion for helping others and making a difference. Previous trustee and vice chair for TAMBA, Twins and Multiple Births Association. So welcome, Hansa. Thanks for joining us today to discuss the vital work and Holding Space is doing in supporting family mental health.
Thank you for having me here. It's great to be here.
So when I talk to people like yourself, I'm always kind of blown away with how much of yourself you give. And so I'd like to just start by understanding a little bit more about you and what's behind you as a person and how you manage to juggle that in your own life.
Yeah, running a charity is not easy. So I am a single parent with 3 children, but I think what drives me is passion. And I have a real passion that parents and carers are supported and the voice of the parent is heard, really. And that also comes through my own journey. So my daughter struggled with her mental health and sadly we got no support at all from statutory services. But in particular, my voice wasn't heard, apart from being told to go on a parenting course. So, as a parent, I already felt like a failure. I felt like I let my child down. I didn't know where to go. I didn't know where to get support. And there were professionals telling me actually it was my problem. So I think that's what leads me. It's that personal experience and that passion that parents are heard and they're involved in this journey. And I kind of juggle it. Yeah, somehow you manage it, don't you? And you juggle life and work as well. But I'm also very good. I think I do have boundaries. I love walking on the beach with my dog. So I make sure I do that every day and have that downtime.
It's so important, isn't it? But listening to you, you've got a real purpose, haven't you? And that drives us through so many things, doesn't it? Strikes me whether that is even a leader into some of the problems we have today. Do you see that in some people when you're working with families and to support their children in terms of what their purpose is? And is that a driver that you see?
As in with parents and carers, I think parenting is very different this age. I think our children grow up in a really different world to when we did. So I think it's not easy for parents and we're almost having to reprogram ourselves as well and look at reparenting. So it's not about anyone's getting it wrong, but I think it is such a digital world, isn't it? They're growing up in a very different environment and then we almost as parents have to keep up with that. And have to look after ourselves as well. I think, it's a busy world out there and as parents or people, we're just juggling so much that taking that step out and just giving yourself some time and some space to look after your own mental health and well-being, I think needs to be encouraged more. And then particularly for parents and carers, which is what we try to do.
I often think as a parent myself and a busy professional, I suppose, that I lose my purpose. Sometimes it takes me quite a long time to really think, well, what do I want? What's the meaning behind me getting frustrated with my teenage child? is out of love, isn't it? The whole purpose is that you love them, but that gets forgotten sometimes, I find, in my everyday life, and you kind of get a little bit distracted.
Yeah.
And it's similar with work, isn't it? My whole purpose for me in my job is because I want to help people, and yet you end up not doing that often, and because of so many distractions in life, isn't there, that you end up kind of veering from that real purpose that you have.
Yeah, it's hard, isn't it? It's really hard. And I think also it's about understanding that there's no perfect parenting out there. Is that we are going to get frustrated, we are going to get it right, we're going to get it wrong. But I think also for parents, it's knowing that what's okay, knowing when to worry. And I think that's where sometimes we don't quite know, like, is this normal? Like you say, is this normal teenage behaviour, or should I now start worrying it's a bit more than that? You know, and yeah, life's busy. I think we all need to slow down to find our purpose and just give ourselves all a break and just go, it's okay. As a parent, as a carer, I'm doing an amazing job, and what I'm doing is enough, you know, but we have these society pressures, don't we? And we have social media pressures, and we think everyone else has got perfect parenting skills, and actually just stop and go, I'm okay, I'm doing a good job here.
Yeah. It's a real double-edged sword, that social media, isn't it? Because I often look at it and you think everybody else's life is so perfect because it's only the good things that get posted. And I think others have that. But equally, from especially the teenage perspective, there's this whole other world that's opened up and that you almost want to protect them from, but you can't. So I'm interested to follow up on your statement around, you know, when should we worry? When shouldn't we worry? I'll let you expand.
Oh my gosh, I wish there was an easy answer to that. I really do. I always say to parents, and I think one thing I've learned is, you know your child better than anybody. So, you know, if you see a dramatic change in their behaviour, or they're starting to shut down, you'll know them, then it's okay to just seek that help. I don't think there's a straightforward answer to that. Every child's different, you know. And I think sometimes it's about empowering parents. So on my journey, I've learned so much about brain, you know, how the teenage brain develops and the changes that teenagers go through. And I think if we can empower parents with knowledge and understanding, then they're better equipped to look out for those changes. And I think that's where we fall down. So I hate the term parenting, go on a parenting course or go on a parenting program. For me, it's more about empowerment. And it's like with any illness, as you all know, or any disease, the more knowledge you have about it and the more understanding you have about it, the better equipped you are to support the person you're looking after. And the analogy I give is, if my daughter had broken her leg, I would have hoped that the medical profession would have stabilised it, operated within a certain amount of time, and taught me how to care for her. Because it was her mental health, I got nothing. Nothing at all. The door was just shut. So I that's why I like to think is, let's start empowering parents and carers and around mental health and well-being, so they have the knowledge and skills to look out for changes and to better support their children at home.
Thank you. Yeah. Empowerment certainly speaks to my heart. And I think as a health system, we're not very good at that, even in the simple cases like, you know, helping people understand what they can do to get better after their fracture. We probably could be a lot better at that. And that's so simple, isn't it, compared to this? So empowerment. Let's choose then an example, and I think is really common. How would you approach it if a parent came to you because their teenage child was self-harming?
We work very holistically. So, you know, every parent or every child will be different. And it's very much about listening to the parent. That's what we offer, is that safe space. It's about walking that journey together with that parent. I'm not a professional. I'm not a counsellor. I'm a parent lived experience. And that's the perspective that we come from. And it's just listening to what's happening, guiding them, signpost them to the right support, you know, and make sure they've got that wraparound support around them. And again, many, you know, parents will say to us, we don't know what's out there. We don't know what the best advice is. We don't know how to support our child, because there is a lot of conflicting advice just around self-harm. You know, what is the guidance and everything. So I think our role, or what we do, is that listening and that offering that safe space. You don't always have the answers, and I think that's okay.
And just to start to understand that you're not on your own,
Yes.
that kind of situation, how common it really
Yeah.
is. Yeah. Any specific, I think, because obviously, I think one of the things about empowering people and that the complexity around that is needing to get that person in front of you to really understand better, isn't it? So I don't think there's a one size fits all. And that's why you exist, isn't it? As a charity, because there's not a one size fits all of saying, if your child is self-harming, these are the services that will help you. So I can understand that one would say, well, come and talk to you guys. What are some of the examples that you might give that you may signpost to in that kind of situation?
Of course, there's national helplines. Obviously, we know that. I think what we encourage people, parents, to do is try and talk to their child, try and keep that communication open if possible. We know it's not always possible, and it's looking at what the latest guidance is. So we try and keep up to date with what the latest guidance is, say, around self-harming and how to manage that at home and keep that child safe. So for us, it's just as important that we've got the latest knowledge or guidance and we know, what support is out. But I think communication is so important, isn't it? And that's not always easy when a child or young person is struggling, because they tend to shut down with their parents and carers. But equally, it's important that parents got that space to talk, as I was saying earlier, just that space for them to offload and to feel that they're supported. And, it's okay to be vulnerable. That's something I've learned on my journey. You don't have to be strong all the time. And actually, vulnerability isn't a weakness as a parent. We're not expected to know it all.
No. And it's a fantastic thing to model for your children as well, isn't it? I think.
Yes, it's a journey. I think we're all on a journey, aren't we? I think every stage of parenting is a learning and a journey. And I'm still learning.
I find it really hard with my teenage kids because I want to talk and they don't want to talk. But actually, and it's only very recently that I've found that text messaging feels really dysfunctional to me, but actually things come out that wouldn't come out otherwise. And actually, why not embrace it? But I found that a real psychological barrier to get over because it feels wrong. But
definitely. Yeah. And I think that's why I said earlier, it's about reparenting because, the way we were brought up is so different to the way our kids are now being in the world that they're in. And something again, my therapist said to me was just WhatsApp. Don't expect a reply. Don't, if your child has shut down, don't always expect a reply, but check in with them through WhatsApp or text messaging because they're going to read it. They're going to engage. So for me, it's finding what works for you and your child and use that method to keep communicating with them. It's not as straightforward as sitting at a table and hoping to have a deep conversation with them. It might be in the car. Might be going walking. Just find what works for you and your child. But and don't be afraid if they don't engage or they don't reply. Just keep letting them know that you love them and that you're there for them, and keep that door open.
Yeah. It takes incredible patience, doesn't it?
Yes.
So I'm also interested in what I see a lot of now as a GP. Families concerned that their children have autistic spectrum disorder or certainly a type of neurodiversity, and that presents great challenges. It feels like maybe that's on the rise. Maybe it's us as a society expecting people to fit in boxes more than previous, but it must be something that comes your way quite often. I'm interested in your thoughts.
All the time. We have so many parents who are waiting for assessments and on the CAMS waiting list. And, that's a 2-3 year wait from what I'm understanding. So are we more aware of it? Is it something I think you see in adults as well, aren't you? But I think that I think the school system needs to be looked at. And I think you mentioned earlier, we're trying to fit people into boxes. And it's not about that. We're all so different, aren't we? And sadly, we've got rid of creativity. We've got rid of music. We've got rid of PE. And it's so academic now. And is that why we're picking up that more and more children are struggling? So it may not be necessarily neurodiversity, though. made some aspects of that. I just think the school system is not all inclusive, and too academic. And we're not all academic, We've all got our own unique skills, and we need to embrace those. The system doesn't allow it.
No, it's really frustrating. And I mean, that's an understatement for many families, isn't it? By a long shot. What have you found helpful then for people who are on this CAMHS waiting list? And it feels like this kind of holy grail almost, doesn't it? Which it never is either, I find, or very rarely is. And once you get. So in your experience, what helps families when they've got these concerns of having a lot of challenge with behaviours, often with school, and they think there's nothing that's going to be done for a couple of years? What do you find helpful?
I think holding space, if I'm really honest. I mean, we're the only charity offering parent peer support, and every parent that's been through our doors said you're the first person who's listened. So, parents are often labelled as being, angry or the difficult parent, or, they're pushing for the child because they are frustrated. They've got nowhere else to go. Nobody's listening to them. And I think communication, that's what they would appreciate. So once you're on that waiting list, often parents will say, we don't hear anything. A year's gone by, what do we do? So I think it needs to be better communication between services and parents and carers, even if it is, you're still on the waiting list, you're still here, we haven't forgotten you, can ease a lot of worries. But parents will just say, nobody's listening to me, nobody's hearing me, nobody's talking to me. And that's what we offer, it's just that space to be heard. There's not, we know the waiting lists are as they are. Sadly, private is not affordable for so many. But if you can put that support, I think what's missing is the early intervention and support on this journey for children and young people. So if we can put that early intervention and support in, even if they're not on a waiting list or while they're on the waiting list, what can we do to support that family while they wait for that diagnosis or they wait for that support? That's the bit that's missing. And, as I said earlier, we're not professionals, but we provide that support. We provide that space for parents and carers to come together so they don't feel like they're forgotten. And I think that's what we hear a lot. So I think for any system or any professional out there that could be listening to this is just communicate with parents.
It's interesting because I think that creates this failure demand almost. Just so we have two types of demand in healthcare. One which is value demand, when someone has a problem, and if you don't deal with it, leads to failure demand, isn't it? And we're seeing a lot of that across the whole piece. And here we could reduce that failure demand just by communicating better and keeping people kind of in the loop, couldn't we? I'm hearing.
Yeah, it's about partnership. For me, it's about working in partnership with parents rather than seeing parents as, the problem. So for me, it's co-production, partnership, walk that journey with the parent, involve them in that journey and make them part of it. That partnership is so important. And I think that's where we go wrong, and we often go, okay, we'll deal with the child or young person. And if we're not working with families and parents and it's not parallel, we're not really making that difference because that child's going back to that family unit, whatever it looks like. So if you're not supporting that family unit, but you're only supporting the child, it has to be partnership working with all agencies, with all professionals involved. And often again, and I think children and young people are also saying what we hear a lot of is, I'm always being told what to do. They're just telling me, they're not involving me, I'm not part of this journey or this care pathway or whatever we call it, and I wish people would stop telling me. So let's come together in a partnership, and value what parents and carers bring to that table as much as you do as clinicians and professionals. That's what I'd love to see.
There's a good lesson for us there. Listen, co-produce, empower. Thank you. And one of the things I wonder is that because people are in this limbo for 2 years, for example, you're going in circles not feeling listened to, there must be quite a negative effect on the child and the family over that time too, mustn't there? So, what are you seeing? What are the reasons that a family, for example, might be advised to almost come and talk to you guys, engage you guys? What are the benefits that they would see in that time, even though we're not going to speed up the CAMS review, for example?
Yeah, I think there's frustration on both the parent and the child's point of view. Often you hear children just say, I just want the support, I want the help. And, without that diagnosis, without that piece of paper almost, they can't move forward. And then is it about maybe looking at how we change the system? Do we need that diagnosis in order to put that support in? If you can see a child struggling, why can't we put that support in? So children, people are frustrated because, again, they're trying to fit into this system. And for parents, the reason they come to us is there's no one else to talk to, and there's no one else who really understands. I think that's the power of lived experience. It's the power of parent-peer support. We've, my team have all been on this journey in different ways, so they really, truly understand. And it's just that space for them to talk, for somebody to finally go, I get it, I hear you, and I haven't got the answers, but we will support you for as long as you need that support. And sometimes just giving them, I think, permission as well. I think giving parents permission, to contact professionals. I think we're often scared that, okay, I'm on a waiting list, I can't really do a lot. So I think we often give parents permission to say, keep in contact, keep pushing, but also permission to say, it's okay, I'm not doing well, or, I haven't got the answers, and that permission to be themselves, to not feel that they have to be the perfect parent.
Your work must reduce that stigma a little bit, so I think that's around it.
I hope so. I really hope so, especially around parenting. Yeah, because as you were saying, social media paints the perfect picture. The school playground paints the perfect picture, and actually, just that, everyone's struggling out there. There is no perfect parent, and just to be in a room with other people who are on a similar journey to you, I think really validates that you're okay.
So moving on a little bit, I'm interested in, you've touched on what changes can be put on place without a diagnosis or anything. And in my limited experience, there's this thing called the Statement of Educational Needs, isn't there? Do you get involved in that at all?
No, I mean, I've got 2 parent peer support workers who are really knowledgeable around neurodiversity and the HCPs and things, again, through their lived experience. It's not my area of expertise, but we don't help in kind of putting the reports together. We can guide people. We can, parents will come into our office, and we're happy, for them to sit there and we, help read what they've written. We'd love to do that, but our team is very small. So, it's capacity rather than, the demand out there. So there's so many other things we can do.
But you're signposting to the best ways to get that done. So you're supporting and this is maybe a minor call then for support, financial support for your charity to help those kind of services expand as well, I suppose.
Yes, definitely. I mean, we're a small charity. We've been going 5 years, but we're not commissioned. We don't receive any statutory funding at all. So all our funding is through grants or kind of donations and fundraising. So any financial support would, anyone listening to this able to support, please get in touch.
Thank you. Yeah. So I will certainly put a link on the website and things so that people can do that, if you're inspired to do so. So what does it look like in practice? It's really clear to me that holding space is about providing this safe space. But what does that look like in practice, and how does it help parents feel empowered to make decisions for their families?
So we have an open door policy. You don't need to have a professional or a diagnosis refer you to us. We do get referrals from any professional school, social workers, key workers, but you can self-refer as well. So for me, it's about breaking down those barriers and opening up those conversations around mental health and wellbeing. We are on the High Street in the centre of Eastbourne. again, it's that open door. Let's make it as easy as going shopping, those conversations and that access to support. So when you come to see us, we always offer you a face-to-face appointment to have a one-to-one with us. And again, very much just working with that parent. So listening to them, getting the history from them, and then working with them as to what is the best support for them. And, making sure that they're signposted to the right organisations. And then we tend to book kind of 3 block appointments, either face-to-face or telephone support, and tailor those appointments to support they need, and working with that family. And that's how we work. And we find that holistic approach is, every parent's different, every child is different. It's not one size fits all. So our support is very, very holistic and very individualised, and working with the parent.
Invaluable, I can see. And if your parent thinking, I wonder if I'm a little bit worried about my child's mental health, should they come straight to you? What's your thinking?
Yeah, both. I think go and see your GP or the teacher. I don't think there's one answer. And come and connect with us, because obviously we can guide you through that journey. But if you're really worried, do contact your GP. Do speak to the school. So I think it's using all the available kind of that journey. And we will always guide you through that journey as well. But in terms of support for you, yes. Do contact us, but follow the other processes as well. I think that's really important. And that's where I think that partnership working comes in. It's about bringing all the people together around that family, around that child and young person, to ensure they get the support.
Thank you. So just to summarise there, I think in children who go to school, the school is really pivotal, I think, to that support, isn't it? And probably the first port of call, given they're there most of the time. But if there's any problems getting to school, and if there's any significant concern, then the GP is that first port of call, isn't it? To make sure. And I think the other thing is maybe coming with questions, isn't it? Especially to GP, what come out with those concerns. I think you've highlighted how well you listen to people, and maybe we as GPs struggle to elicit that in the time that you've got with people. So I think one of the tips is write it down, write your concerns down, really reflect
100%.
on what you're worried about, what you're expecting, so that it's out on the table, isn't it? And then you can have a sensible conversation about where the right support will come from.
Oh, 100%, yes. And I always say there's never a stupid question. Every question is valid. But I think we've got to get away from this notion that everybody needs to be referred to CAMHS. So I think when parents come to GPs, it's almost like, I need a referral to CAMHS. And that's not always the answer. And I think that's where we need some system change as well, because not every child needs to be in CAMHS, but we need that early intervention. We need that early support. But it feels like that's the only door at the moment to get that support.
I agree with you. And actually, this is an important point I'm glad you've raised, because as GPs, we're not experts in any way in children's mental health. What the tools we've got is to assess risk, so we can help understand the risk at which a child is at, and therefore try and understand what route is the best route to take and how quickly. But the vast majority of children are at a lower risk themselves if we're thinking about the spectrum from being suicidal to being, healthy and very happy. And so the vast majority of children that I would see would benefit mostly from the school services and the psychological services. And I certainly wouldn't want to refer somebody to CAMHS without the support of the school. So I think there's another thing to say, is that obviously if you're worried about risk, absolutely there shouldn't be a reason not to go to your GP. But equally, I think trying to pull in the school services, and we as GPs can support that, but the more we've got from the school services, the better, I think, to support that child.
Yeah, it's look at the right support, isn't it? It's where's that right pathway for that family and child and young person. But for me, it feels like, and I think that's where it comes back to educating parents as well, because it's knowing what's available out there. When I was on my journey and I worked for a charity at the time, I got a nursing background. I still didn't know the system when it came to the mental health services. I didn't know where to go. And half the stuff I know now, I wish I'd have known then. So I think we need to be more open to people, general public, parents are aware of what's available out there. So it's fitting the right support around that person, isn't it? That family or child or young person. Whereas at the moment, it just feels like everybody seems to want to go to camps because they don't know any different.
Yeah.
So I think there needs to be a lot more education out there of what services are available.
And so for people in school, there's the psychological services and things, and that's accessible just through the schools, really, isn't it? So that's worth highlighting. I think from my perspective is that in adults, we can refer to psychological services, but in children, we can't, and that is accessed through the school, really. And that's why I think one of the reasons why we end up going to CAMS, because that's the only one we can refer to. It must be quite a common situation for you to be involved in where we've got children being schooled at home, part of the reason being the one that they want to address. And what support is there that we can signpost to in those kind of cases?
There is a home education group in Eastbourne, so we would signpost to them to make sure that they got the support. And so many more children are out of school, aren't they? But there is a very active home education group, and I think it's around East Sussex. I think there's different groups. There's one in Hastings, one in Eastbourne. So again, it's about making sure that family have got the right group or right support around them. But they're all, it doesn't matter what your child, young person is going through. For us, it's that parent peer support. We're always there for you.
Yeah. Really central to the coordination that the family can play in their care. Okay, so I touched on one of the take-home messages that I felt from you as being kind of communicate, and who with, I suppose that's the school, the GP, and people like yourselves. What was the take-home message that you were hoping to kind of get across?
Oh, gosh. I think whoever's listening to this, I think listen to the voice of the parent and carer. So as a professional, please take that time to listen to that parent carer that's in front of you, because they know their child better than anybody. So just take that time and try not to judge. I think we just do in life, don't we? I think for parents or carers that might be listening to this, know that you're doing an amazing job, that you're doing the best that you can, and that you're not alone, and there is support out there for you. And let's get that early intervention support in for our children and young people. Let's recognise our children and young people are struggling, sadly. It seems to be on the rise. So let's have those open and honest conversations around mental health and wellbeing and normalise it. And just know that you're not alone.
Yeah, absolutely. It's worth remembering, isn't it? When you think you're not being a good parent or you're stressed about the situation, don't know what to do, the reason why you feel bad is because you love that child, and that's the best gift you could give them anyway, isn't it?
It is, but it's hard, isn't it? When you see your child struggling, or if your child's shut down from you, you'd always love them. But I think sometimes it's so hard to get through to some children that's where the feelings of I'm a failure, I'm getting it all wrong. There is no perfect parenting, and something my therapist once said to me is you're doing the best that you can at that time with the knowledge and skills that you have. And that's all we do, isn't it?
Absolutely. Gosh, thank you. It's certainly really helpful for me just to have this conversation, because I have my own feelings about my parenting skills and how I could do better. So it's really been helpful for me just to talk about it and hear that, I can understand that people might think, well, he's all right. But, we all have our challenges, don't we? And that's really helpful to hear that others do too. So we'll leave your website details on our website. What do you want to just share it in case people are driving or whatever? How would they find you on Google or something like that?
www.holdingspace.org.uk, and then we're on all social media channels as well. So Eastbourne Holding Space.
Fantastic. Thank you. And is it just Eastbourne that you support?
No, we cover East Sussex and sometimes a bit wider.
Wow.
We generally don't tend to turn a parent away, but we are across East Sussex.
Fantastic. In our upcoming podcast, we're speaking with Hansa Raja about the role of pharmacy first and how community pharmacies collaborate with GP practices to enhance patient care. What would you like to ask them?
Oh my gosh. Now you've thrown me.
Oh, that's mean, isn't it? So it might be about even this very subject. Now, I think pharmacists get a lot of questions.
I'd like community pharmacy or pharmacies across really just to be aware that we exist. So if you come across a parent or a carer or, look out for those signs and signpost them. Be aware of the services that are out there. Because I think, community is becoming a big thing, isn't it? And, pharmacists are like GPs, another area where people talk to your pharmacist or you have that space to talk to them.
So I'll ask them maybe how common is it that they are approached about the problem? Because I suspect they're involved a fair amount around children who aren't sleeping. For example, can I have this? And maybe it's about, how often do you open up the conversation about your child's mental health and other ways to support them?
Yeah.
Good. Thanks very much. It's been a fascinating conversation, and I can see that you help so many families in East Sussex. I'm really grateful for your time today to share some of the work that you do.
Thank you so much. It's been amazing being here.
You've been listening to the Health and Wellbeing podcast, where today's focus was on supporting parents navigating mental health challenges for their children with Hansa Raja and me, Dr. Nick Harvey. For more information and resources, check out our website, sdhc.org.uk. If you have any feedback or suggestions for future episodes, please email us at sdhc.feedback@nhs.net. Join us for our next episode, where we'll be speaking with Hansa Raja about pharmacy first and the vital role community pharmacies play in partnering with GP practices to improve patient health. Please take a moment to subscribe to help support us in empowering others with their health and well-being.